Hi, welcome back to Firmly on the Fence. In today's episode, we'll be tackling a crucial issue affecting healthcare in the UK, that is the ongoing strike by junior doctors. The junior doctor strike, which will be the longest in NHS history, has been causing headlines as it's coming at one of the busiest periods of the year for hospitals, causing disruptions to an already overloaded system. So first things first, why are doctors striking in the first place? The British Medical Association, or BMA, which is the trade union that represents about 65% of junior doctors in the country, argues that they've received a 26% pay cut since 2008 in real terms, so that's adjusted for inflation. And the aim of the union is a full pay restoration to those 2008 levels, which would represent a 35% increase in pay, which is what the union is asking for. The next key question here is the government willing to negotiate? The government, led by Health Secretary Victoria Atkins, has offered them a 3% pay increase, which is coming on top of the 8.8% junior doctors got last year. But that's still seen as far from being enough by the BMA, who refused the offer and called for the strike. The government's position is that while there's a strike going on, the negotiations are off. What impact then does the strike have on the NHS? Estimates suggest that around 1 million operations and appointments will be cancelled during the strike, with only emergency care being prioritized at this time. Now, this is coming in a context that is already pretty bleak for the UK when it comes to healthcare. In 2023, the UK had a record number of excess deaths, with about 53,000 more people dying than the normal average. A big factor contributing to that is really long waiting lists and people not being able to access care when they need it. So delaying a further 1 million appointments and operations is naturally going to just add to that issue. But of course, something that also puts a lot of pressure on the NHS is simply not having enough doctors. Currently, more and more doctors in the UK are choosing to go work abroad in places like Australia, for example, where they can earn 3 times the amount of what they're earning in the UK out of university. So by fixing pay here in the UK, you would be attracting more people into the labour force, keeping people into the labour force, which would naturally reduce the pressure on the NHS. So with all the delayed procedures, is the public even supportive of junior doctors? It seems like the recent polling is showing that about 53% of the population here in the UK is actually supportive of the junior doctors and them taking industrial action. Thanks very much for watching this episode. Let us know in the comments below whether you support the junior doctors and their industrial action, and please don't forget to like and subscribe.